Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd answer a comment about lung cancer screening. I'll show you the comment right now. So this is it. As we get older, is it just basic protocol for a doctor to want us to get a lung cancer screening as part of our annual physical? So I thought this was an interesting comment and a question that basically comes up a lot as to why your doctor may want you to go and get maybe a chest CT scan, so CAT scan of your chest, just to look for lung cancer, even though you have maybe no symptoms. So the reason why your doctor may want you to get that is because some people may be at a higher risk of developing lung cancer. So potentially, if you're someone who is maybe has smoked for maybe 20 years, 30 years, maybe you're developing a little bit of chest issue or there's something else going on, your doctor may feel that potentially there is a higher risk that in your case you may at some point develop a lung cancer. Now that's not something that happens for everyone, like it's still a rare occurrence, but however, when it does happen, if we do find potentially lung cancer, it's better to find it early. So that's why people who are at higher risk of developing this condition, the lung cancer, if we find the condition earlier by doing a low dose of radiation chest CT scan, that can be beneficial because the treatments for lung cancer these days are actually quite effective. There's been a lot of progress in the field, and the sooner we detect it, the better their options are. But generally, that lung cancer screening, that active program to actually go and get a chest CT scan if you don't have any suspicion that you might have lung cancer, is only offered to people who have high risk. So that would be, again, someone who has smoked maybe for many years, maybe if you're over the age of 55, because we generally expect that people will develop lung cancer a bit later in life. It's not something that generally happens in very young people, but that is of course on a case-by-case basis. So your doctor may make these decisions, may make these recommendations based on your individual risk. So it's not a one-size-fits-all strategy. The problem that we have if we do chest CT scans for everyone without risk factors is that we may actually either just give you a lot of chest CT scans that, give you some radiation if we repeat them every year for no particular reason, and that can increase the risks of other issues popping up. Or potentially another thing that may happen is that we may actually find a lot of what we call incidental findings. So we might find some abnormalities in the lungs that actually have no clinical consequence. A lot of people, unselected people, if we do a chest CT scan on someone who's just like presented to a clinic, came off the street, has no medical problems, there is a chance that we may find something in the lungs, but it doesn't mean that that's something that will turn into something nasty, like a cancer or some kind of lung fibrosis or something else. It's not always the case. So that's why we tend to take a risk-based approach, because otherwise it would be completely ineffective. We may not find the right condition that we're looking for. We may find something that's probably not going to change someone's life. And the other thing would be that it would be a very costly strategy for the health system. And I know this sounds a little bit pragmatic, but we have to take that into account, because if every person in the world would go and have a chest CT scan, you can imagine that the health system would be overwhelmed. So people who will actually have problems and need to access the health system really quickly may not be able to do so because of extensively long waiting lists. So this is why this is such a risk-based strategy, and it is offered indeed. So the lung cancer screening can be offered to people who have high risk. It may not generally be offered on an annual basis, like the comment was saying, because it will generally be offered once, and if no sign of cancer is detected, then you can be reassured that probably there isn't something that's going to imminently appear in the next year. It takes a bit longer for these tumors to grow. So that would be also an opportunity, for example, if you have risk factors, to try to eliminate them. So if you're an active smoker, you've been smoking for 20 years, it's always a good idea to quit. So if you access the lung health check program or the lung cancer screening program, these programs have been established in different cities around the world and they have different names, but that's an opportunity to access, for example, smoking cessation services in your area. So it's a good idea to have these programs, but it's always based on your individual risks. So I cannot tell you, from my perspective as someone who has never met you watching this video, I cannot tell you what your individual risk is, but your own family doctor, GP, general practitioner, or pulmonologist that you're seeing may be able to evaluate the risk in your case, may be able to make some lung health recommendations for you. And these may sometimes include screening for lung cancer, trying to find that early if you have a high risk. But again, it's not something that's offered generally on an annual basis or to absolutely everyone. It's usually for people who, like I said, have smoked for quite a lot of years and they're probably a little bit older, so over the age of 55, not someone who's really young. Hopefully this was a helpful explanation. If you have further questions, do leave them in the comments and I'll try and answer some of your comments in a more unscripted way as I was doing in the past. I apologize, I've been away for the YouTube channel for a while for different reasons, but I'm trying to be back. Thank you very much for watching. All the best and good health.